If you are elderly or care for someone who is, have you ever hesitated before putting a spoonful of pork fat into the pan because someone told you it would clog arteries? Or, on the opposite side, felt the comfort of a family recipe that always used lard? That question is exactly why I want to speak plainly today. Pork fat is not a simple villain or a magic cure. Its safety depends on four things you can control: quality, dose, how you cook with it, and the health context of the person eating it. I'm Dr. Ana Mendez, a physician with years working alongside older patients on nutrition and chronic disease prevention. If you care for an older relative or make food for someone with chronic conditions, stay with me to the end. I'll give clear, practical steps you can use in the kitchen and at the market. If you find this helpful, please subscribe, activate notifications, and leave a like so you'll see the next piece where I talk about inflammatory foods and how to spot them. When we look at the story of fats in our diet, there was a big shift over the last century. For most of human history, people cooked with animal fats, butter, or whatever plants were locally available. In the 20th century, industrial processing made refined vegetable oils cheap and promoted them as heart-healthy. Around the same era, a chemical process called partial hydrogenation was used to stabilize oils for shelf life and texture. Partial hydrogenation takes liquid vegetable oil and adds hydrogen to some of the unsaturated bonds. The consequence is the formation of trans fats. Trans fats are a specific type of altered fat that many studies suggest raise bad cholesterol and are linked to cardiovascular events. The language of research is cautious. Evidence indicates an association between trans fats and increased risk, and reducing trans fat intake has been associated with population improvements in heart disease rates in some places. To understand what matters for heat and health, it helps to know very simply how different fats behave. When nutrition researchers talk about LDL and HDL, they are naming lipoproteins that carry cholesterol in the blood. LDL is often called bad cholesterol because higher levels tend to be associated with greater risk of atherosclerosis. HDL is often described as good because it helps move cholesterol away from arteries. These are imperfect labels, but useful starting points. When oils are heated repeatedly or to very high temperatures, they can break down and form compounds such as peroxides and aldehydes. One particularly nasty chemical sometimes mentioned in this context is acrolein, which is irritating and formed from glycerol breakdown when fat is overheated. These oxidation products are more likely to cause damage than the original fatty acid profile alone. So where does pork fat or lard fit into this picture? Typical traditional lard contains a mix of fatty acids, roughly around 40% saturated fat and roughly 45% monounsaturated fat, with a smaller proportion of polyunsaturated fats. Saturated fats have often been viewed warily because of their effect on LDL cholesterol, but monounsaturated fats, the same kind that predominates in olive oil, tend to be more neutral or even favorable for lipid profiles. The balance in lard gives it reasonably good thermal stability compared with oils that are high in polyunsaturated fats, such as sunflower or soybean oil. That thermal stability means lard keeps calm under heat, better than oils with many polyunsaturated bonds, which are the ones that oxidize quickly when heated. That said, thermal stability does not make lard automatically safe for everyone in any quantity. Safety is a function of dose and context. Studies suggest that dietary patterns rich in processed foods, refined carbohydrates, and excessive calories contribute to cardiovascular risk independently of the particular fat used. In other words, a tablespoon of high-quality lard as part of a balanced meal is not the same thing as repeatedly frying large portions of processed dough and serving it alongside sugary drinks. I remember one afternoon at the market when I asked a woman at a small stall about the jar labeled traditional lard. She scooped a little on a spoon and handed it to me. It smelled faintly of cooked pork, pale and slightly creamy, firm at room temperature but softening with the warmth of my hand. "This is made by a neighbor who keeps a few pigs and renders the fat slowly," she said. The sensory clues were meaningful. Traditional, unbleached lard tends to be pale and more solid, free of additives and heavy processing. Industrial lard or lard blends sold for mass production can contain additives, hydrogenated fractions, or mixing with cheaper oils, items to be cautious about. When you talk to a producer or an attentive butcher, ask how the fat was rendered and whether any additives or hydrogenation processes were used. Prefer lard that is simply rendered pork fat without emulsifiers, artificial flavors, or long lists of ingredients. Picking a good source is step 1. Step 2 is how you use it. For older adults, I recommend thinking in terms of rotation and moderation rather than exclusion. Use a variety of fats across the week: extra virgin olive oil for dressings and low to medium heat cooking, ghee or clarified butter for moderate heat, coconut oil when a recipe benefits from its flavor and for certain high heat preparations, and lard when you want the texture and flavor it provides, but not as the exclusive fat in your kitchen. Rotating fats gives you a broader range of fatty acids and decreases repeated exposure to any one set of oxidation products. Practical guidance on dose matters because caregivers often ask, how much is too much? A reasonable, conservative reference for a generally healthy adult, around 70 to 80 kilograms, is on the order of 20 grams of lard per day as part of the total fat allowance of the diet. To picture that, 20 grams is roughly 1½ teaspoons. Context is crucial. If the older person has high LDL cholesterol, a history of cardiovascular disease, or is on medications that affect lipid metabolism, your physician or a registered dietitian should tailor targets. Never abruptly change medications or stop prescribed therapy. Dietary adjustments must be integrated with clinical care. How you cook is another major factor. Refined vegetable oils rich in polyunsaturated fats are more prone to oxidation when exposed to high heat, particularly if reused multiple times. Oxidation leads to peroxides and aldehydes, compounds that we want to minimize in the diet. If you're frying frequently at high temperatures, prefer fats that are stable under heat. Lard and ghee are more stable than many unrefined vegetable oils. Even so, avoid overheating any fat to the point of smoking and try not to reuse oil multiple times. For shallow frying, moderate temperatures and shorter cooks reduce the production of harmful breakdown products. Also, consider cooking techniques that use less oil overall. Oven roasting, braising, and using non-stick surfaces can limit the amount of fat needed while keeping flavor. A frequent concern is how lard compares with olive oil, a common recommendation in nutrition advice. Extra virgin olive oil is rich in monounsaturated fat and contains antioxidants, which can protect against oxidation. But it is not the highest heat oil. For dressings and gentle cooking, olive oil is excellent. For high-temperature frying, a more heat-stable fat may perform better. The point is not to elevate one fat to an absolute moral good and another to a total evil, but to understand their properties and use each where it makes culinary and health sense. There are also special considerations for older adults beyond cholesterol. Many elders take medications that interact with diet, have limited appetites, or deal with conditions such as diabetes, renal disease, or pancreatic insufficiency. One's caregiver told me about her father, who had a small appetite and relied on denser fats to maintain weight.
In that context, the caloric density of a little lard could be useful to prevent unintentional weight loss, but only under medical supervision. Conversely, someone with uncontrolled LDL elevation may need stricter limits. That's why I stress consultation with the person's physician or a dietitian before making sustained changes. Back in the kitchen, there are simple checks you can do to choose lard wisely. Smell and texture are telling. Clean, soft creaminess with a mild cooked pork scent is reassuring for traditional rendered lard. Avoid jars with an off, strong, rancid odor or products that list partially hydrogenated or long chemical names on the label.
When buying June's small producer, ask how the fat is rendered. Slow rendering without excessive heating preserves quality and avoids creating burnt flavors and oxidation. Packaging matters too. Airtight, refrigerated storage extends shelf life and reduces the chance of rancidity. If you must use a vegetable oil for frying, choose refined oils designed for high heat use and avoid repeated reuse. Emotionally, food carries memory and comfort, and lard often appears in family recipes that have meaning. That is not trivial. Food that nourishes the soul matters for elderly people's quality of life. What I ask caregivers to do is balance that cultural and emotional value with safety. Keep cherished recipes, but adapt portions, cooking techniques, or frequency so the older person can enjoy them without unnecessary risk. When we look at population trends, it is clear that changes in processing, availability of cheap refined oils, and patterns of carbohydrate consumption have all intersected with cardiovascular disease rates. Researchers point to these shifts as part of a complex picture. Causality is never simple. The prudent approach for an individual is to use evidence as a guide, not a dogma. If you remove all joy from food to chase marginal gains, you may harm quality of life. If you ignore clear risks and use large amounts of any unstable fat in repeated high-heat frying, you increase exposure to harmful byproducts. So what should you do tomorrow? First, audit what's in your kitchen. Check the labels, ask producers about rendering methods, and place a small jar of clearly labeled lard in the fridge, rather than keeping large quantities at room temperature. Second, think in teaspoons, not cups. Small amounts used occasionally for flavor are less concerning than daily heaping portions. Third, rotate your fats across the week and match the fat to the cooking method. Fourth, if the older person has chronic disease or is on medications, make an appointment with their clinician or a dietitian and bring a photo of the products you buy. Fifth, watch for practical warning signs. Sudden changes in weight, new digestive symptoms, or lab results of lipids that move upward. These warrant medical follow-up. To answer the question that opened this talk, is pork fat dangerous for the elderly? The honest, science-aligned answer is that it is not inherently dangerous in small amounts when it comes from a quality source and is used appropriately. Risk increases with poor quality, hydrogenated, or repeatedly overheated fats, excessive portion sizes, and when the person has pre-existing cardiovascular risk that is poorly controlled. Context is everything. If this discussion cleared up some myths and left you with practical steps you can use now, I'm glad. If you want to go deeper, I have a complimentary piece where I walk through specific foods that drive inflammation and simple swaps that preserve flavor while protecting health.